Hello, everyone. Welcome, Vince Hartman from Abstractive Health. And guys, this is another podcast that I'm recording for the Zero Hiccup podcast, where we are speaking with a lot of founders who are making it large in the technology space. So today I have Vince Hartman. And Vince, why not we start with a quick introduction about yourself and Abstractive Health?
Nice to meet you. I've been in healthcare about 10 years, and I started my health tech journey working at Epic Systems, which is based out in Madison, Wisconsin, for 2 years. I was a product manager, and then I went into consulting with Accenture for about another 6 years. I worked with another number of physicians, and it was actually during this time that I saw a lot of doctors struggling with writing and using notes within the electronic medical record. I came up with the idea of automating clinical notes and went back to grad school at Cornell Tech, and I did my research on automating clinical notes. And after grad school at Cornell Tech, I was fortunate to be able to spin out into a startup, and we've been at it for about 6 months with Abstractive Health, and we're based out of New York City.
Okay, cool. And talk more about the success Abstractive Health has achieved in the last 6 months.
Yeah, so as I said, we started in May of this past year, and we began through an investment with Cornell Tech. So they invested $100,000 and gave us office space on Roosevelt Island in New York City. During that time, we've also been able to bring on New York Presbyterian as a pilot customer. So we're taking all the data in the patient record and we're summarizing the content. So the physicians at New York Presbyterian, when they see a new patient, they're able to quickly understand who that patient is without having to read through the whole chart. And so we're in the process right now of doing integration with their electronic medical records. So we can fully go live and they can use our product.
Cool. So tell us more about the hard parts of building Abstractive Health, especially around NLP and around EMRs.
Yeah, so I would say one of the more challenging things within the health tech space is the amount of integration that you have to do with the electronic medical record. So I did it for 6 years, and even that, it is a challenging lift. You have to do quite a bit of an older API language that's known as HL7. And so a lot of effort we're doing in that manner. And then we found it quite challenging recently to do all the infrastructure, standing it up in AWS, because we're a enterprise solution for like B2B. We have to have our tech at a level that might be much further along than what a lot of people would do with an MVP in a startup. So we have to meet a higher barrier when we are first getting started. So that's quite challenging in the health tech space. And then the last is we have to go through a number of audits for HIPAA and PHI, because we have to make sure that our database, our infrastructure, and all of it is secure, and so that we won't be liable if there was a data breach in any manner, that we've fully made it safe.
Cool. And any pro tips about how you went about solving these problems, especially for fellow healthcare founders that you'd like to share?
Yeah, so for the infrastructure, I would highly recommend, do a little bit of your research yourself, but I'm a machine learning person and software engineering, and I even had to bring on an expert. So I found someone who was really great at AWS, and what would have taken us 50 hours, we were able to do in 5 to 10. So I would highly recommend, for fields that you aren't competent in, bring on the experts. And then likewise for the API integration, we're very familiar, but for some, we still need that support. So understand where your strengths are, and then where you're not as strong, bring on experts.
Great. So my next question is, Vince, would you like to share an example of how Abstractive Health has been successfully implemented in a real world setting? Talk more
Yes.
about that. Yeah.
Yeah. So going back more into the technology. So we spent 2 years proving our model works. So we did a research assessment under what's known as an IRB with Weill Cornell, where we have access to about 10 to 15,000 patient charts. And then through their data set, we built out our summarization algorithms where we took the whole record of a patient and then recreated a summary of what a doctor would manually write. And then once we had this summary being fully automated, we then did a blind test, so kind of like a Turing test of the doctor, so that he didn't know he was seeing our computer, and that he didn't know which one was the manually written one. And then he rated them both. And it was through this assessment that we were able to show that we're able to emulate what the physician writes and then present our summary to them at the time that the patient arrives. And so they can understand faster. And so it was this physician assessment and this research that we've really been able to highlight how our product works. And then at the moment now, we're, like I said, we're implementing it in a production setting so that it's accessible within the electronic medical record of Epic.
Okay. So, Vince, one of the things that many founders, face, especially in healthcare, is being able to make it accepted along the status quo. Like people have certain habits, practitioners have certain habits, and they are not ready to change that habit. So, how did you overcome that startup dilemma, like the chicken and the egg problem or the catch-22 problem, like convincing your end users to use the product?
Yeah, so our solution, we're not attempting to try to remove the physician from their normal day-to-day within the computer. We're just trying to expedite the process. So when they're in Epic or let's say Athena, Cerner, Allscripts, these are electronic medical records. When they're in them, they will just click an activity button to see our summary, and it's only one click, and then they're have access to this narrative form of what happened to the patient. And then once they sign off on that summary, they can push it back as their note in the electronic medical record. And so this workflow that's very seamless, that's one click, and it takes them much less time than they would spend otherwise, has been a big win for them. And so they're very much in favor. So we focused very early on building products for the doctors. A lot of other health tech startups may have challenges where they shy away from doing that integration in their existing computer systems. And it makes a workflow that's clunky, and the physician needs to go to another platform, another
Right.
activity,
Right.
double document, and
Right.
it's this process usually that's painful.
Right. The other thing that I've found in my experience with healthcare founders is that integration is something which is always such a large effort that most founders would shy away from it unless it is really necessary. So, what do you suggest? Like, have you used any third parties to integrate, or have you gone with the conventional integration, and how you have overcome that dilemma?
So I'm unique in that I came with a decent amount of EMR integration, and I've helped other startups do the process with
Okay.
doing it in EMRs, and we did not we haven't chosen at the moment to go with a third party. We've chosen to do the somewhat build it yourself open source approach, and we're building it out in like I was saying, our AWS infrastructure. So there's this open source tool called Mirth that's an interface engine that kind of powers a lot of the healthcare infrastructure behind the scenes that a lot of people don't realize. And so we just chose to download our own version of that open source tool, Mirth, and we're going to use that for translating the messages. I would say, as a health tech founder, to lean in on the integration, because once you get it all set up and you do it, you can expand and you can really scale. Because as in this day, if you get the top 5 to 6 electronic medical records integrated with your product, then you've basically gotten
Right.
60 to 70% of the market, and you don't have to spin it up yourself, spend lots of money in terms like having this like dual structure of your product versus electronic medical records.
Right. Right. Makes sense. So, talk more about the future, Vince. Like, what are your plans for Abstractive Health, and how do you see the company evolving over time?
Yeah, so our future is we will be going live with our pilot customer with New York Presbyterian in the next few months. We're also looking to bring on 1 to 2 more large medical centers so that we speed up their note writing process. Looking in the New York City area for another, or maybe outside, definitely within the United States customer. We predominantly are focusing on English speaking because our NLP is very English oriented. And then in terms of expansion, so once we bring on a few of these large medical centers, we will also then look at a few smaller players that are outpatient practices and physicians. Big goal is that literally any physician that wants a quick summary of their patient would be able to access it through our platform. And we're like the Cliff Notes if you want to read someone information quickly about your patient.
Great. That's a great vision, and I definitely feel that can create a lot of value given the situations that doctors get into because they just don't have time or have to hurry up, and it's just so important. So yeah, that's a great vision and mission, Vince. So last question, because we are starting a new year in the next fortnight. What are you betting on in terms of technology trends for 2023?
So the world has recently seen in the last 2 to 3 weeks the success and like been kind of overwhelmed by this transformer NLP called ChatGPT. So I see that large language models such as ChatGPT have already started to dominate the healthcare space. I see over the next year, you're going to see artificial intelligence like ChatGPT and these large language models really start to not necessarily replace, but augment a number of workflows, especially in healthcare. So you're going to see tools like that we're providing, saving physicians writing their notes. You're going to see before you go to your patient visit and a much better chatbot so that it takes in your patient questionnaires and your patient forms seamlessly and feeds that in. You're going to see physicians not have as much reliance on their administrative staff. These bots are going to be able to do the coding and the scheduling an appointment process seamlessly. It's going to be very beneficial for doctors since they're going to be it's going to focus on reducing burnout and the burden that they've been placed the last 10 years from these computer systems that didn't have these tools. So it's going to be really changing of the structure, these large language models.
I think maybe we can say all falling into place finally for the physicians.
Correct. I mean, that's the goal.
Yeah, right. So thank you so much, Vince, for being such a humble and honest speaker for us, because I think you really shared your heart, and thank you so much. And I believe it will be really helpful for fellow founders. With that, we wrap this session up. Thank you.
Thank you also.